Welcome to YourForState.com's Medical Corner. I'm Lynn Lawson. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you, Lynn.
And our first question for you, what is plantar fasciitis?
Plantar fasciitis is also called heel pain, and some people call it a heel spur, but don't let that fool you. It's not caused by the heel spur. Plantar fasciitis is inflammation of the plantar fascia, or degeneration of the plantar fascia, which is also called plantar fasciosis, but there's a lot of terms. So basically, we'll call it plantar fasciitis, and it goes from, the plantar fascia is a ligament, and it goes from the heel up here to the toes. And it's a tight band, or a ligament, that's on the bottom of your foot. And when it gets inflamed, it causes pain. And if the inflammation is there long enough, you get a little bit of a heel spur right there. But the heel spur doesn't hurt you. It's just a sign on x-ray that we see that says basically, hey, there's inflammation in this area, and that's what's causing the problem. Now, as a patient, you want to get rid of the pain. And so if you get rid of the inflammation in the plantar fascia, the pain goes away.
And how do you treat plantar fasciitis?
Well, treating plantar fasciitis is directed at, like I said, getting rid of the inflammation in the plantar fascia. So how do we do that? Well, the main thing you need to do that is stretching of the calf. And if you do calf stretching, the calf muscles turn into the Achilles tendon, which then turns into the plantar fascia on the bottom of the foot. So if you stretch out the calf, you'll stretch out the plantar fascia, and by doing that, you'll get rid of a lot of the inflammation. And there's a lot of equipment. I mean, plantar fasciitis is an equipment-intensive disorder. So we check your insurance, and we see if we can get you these braces and devices that can help take away the inflammation in the plantar fascia, such as a night splint, which is something you wear at nighttime, and it holds your foot back like this. So you stretch out that plantar fascia all night long. And there's an air heel, which has a little bit of an air pad that goes on the bottom of the foot here, and an air pad back here. There's a tube connecting them, and when you walk, you know, the air pressure kind of massages your foot, and that takes away some of the inflammation. Custom orthotic devices or shoe inserts can go inside your shoe. That really helps a lot. Steroid shots can also help. We do a series about 3 every 6 months to help that go away. And actually, it doesn't really just mask the pain. It takes away the inflammation because it's a steroid. And then finally, if none of that works, then there is a small surgical procedure that can be done in the very end. If not, 95% of people get better with this without surgery, but sometimes people have to have it. And so what we do is we make a small cut on the inside part of the foot and a small cut on the outside part of the foot, and we just nick that plantar fascia, which lengthens it, which takes away the tension, which takes away the inflammation. 2 stitches, takes 5 minutes, and you're done. So usually that takes care of all the problems with heel pain or plantar fasciitis.
Thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on YourForState.com.